17. The past 2 days were quite eventful. We had multiple talks by renowned speakers. We had interactive sessions held by Open Learning and an educational insight into what ubiquitous learning and open distance learning is all about during the panel discussion yesterday. So today we have a lot more talks lined up, and the topic that will be circulated around today is information literacy. And also the students can look forward to the awards giving ceremony for the library quiz competition. So without further ado, I would like to invite Prof. Jai Mohan, the Professor of Pediatrics and Healthcare Informatics, to give his opening speech on information literacy. Please give him a hand.
Good morning, everybody. I'm glad for the audience that is here. It reminds me of giving lectures to students. But if the lecture is at 8 o'clock in the morning, there'll be about 1/4 of the class present, and then gradually the numbers will increase until maybe about 1/3 of the class is present. But if the lecture was at 10:30 in the morning, it would be a different story. There'll be a much bigger crowd. Now, I don't believe in lectures. Unfortunately, I actually have students do the work and they make presentations to me. I don't give lectures because I don't believe in lectures as a medium of education. Unfortunately, in this conference, I find myself giving 2 lectures, 2 days apart. But there seems to be no clever way of having this content sent to you earlier so you could go through it and, prepare for the discussion subsequently, which may be to develop your critical thinking skills, your problem-solving skills, to enhance deep learning. So, be as it is, let me give the lecture, and I will try to keep it as... That was worrying. Okay. Yeah. Okay. Looks like Okay, now brief synopsis. I have biomedical knowledge is growing at an unprecedented rate. Just in case professional education provides too shallow an education and needs to be replaced by just-in-time and just-for-me systems of assessing knowledge and developing health professional competencies. In future, we'll have personalized genomics, nanotechnology, automation, robotics, embedded sensors, telemonitoring, telehealth, artificial organs, 3D printing of biomaterials and drugs, full physiological simulations, artificial intelligence, electronic decision support systems, and mobile medical apps. So, it is unlikely that you'll be introduced to anything but a small portion of this while you are in the university. And you'll have to spend much of your time updating yourself in the new developments in healthcare. So traditional information has changed little in the past decades, and the need to understand and utilize these tools and newer ones for the benefit of the healthcare client is not satisfactorily addressed in the curriculum. So students also need to be prepared for rapid changes with the mastery of 21st century skills. Now, this is the Economist, an issue that points out how jobs are going to disappear in the near future. That if students entering university now will find that they are, after graduating, not going into the jobs they thought was waiting for them, because many of these jobs are going to disappear. And even if they continue to exist, they will continue to exist in a very different fashion because of automation, because of machine learning, because of robotics. So we have to create adaptable students who can continue to train themselves even after leaving the university and having little or no access to their teachers. Biomedical knowledge is doubling at a very rapid rate. By 2020, it will double every 70 days. Right now, it is something like doubling every 100 days or so, which means that much of what you learn in your first semester in the university is probably out of date by the time you graduate. And you don't get refresher courses in the areas where it has already changed. Sometimes even your lecturers, your teachers, your academics are not aware of some of the changes that are taking place because they are impossible to keep track of. Now, doctors need to, I'm talking of doctors meaning healthcare professionals, need to stay current on 10,000 diseases, 3,000 medications, 1,100 lab tests, and 40,000 articles added to the literature. So that is impossible for the human brain to encompass even a portion of this material. Luckily, you all have very powerful computers in your pockets, which can carry all the information either directly on the tool or through access to internet resources. And so content is not the big challenge, but knowing what content to access at the time you need it for the benefit of your client, that is the challenge. And that is why information literacy is so important. Larry Weed, as early as 1999, Larry Weed is the inventor of the problem-oriented medical record, which some of you will meet in practice, said that medical decisions are still largely based on the clinical recall and processing of complex information by highly trained physicians. Yet, their cognitive inputs fall short of what medicine requires, too often producing decisions that are deficient in quality and resistant to organized improvement. In other words, a lot of the time the care you get is inappropriate and could not only not benefit the patient, but also could harm the patient. Don Berwick, the president of the Institute for Health Improvement in the US, pointed out during a time when his wife was admitted to hospital for an extended period of time, that he said hard-working doctors, well-meaning doctors, in treating his wife, every day he saw some sort of mistake being done in the hospital setting where the wife was staying for quite a lot of time. You know, wrong drug being given, drug that has been cancelled continues to be administered, drugs that interact with each other continue to be administered, the medicine is given at the wrong time, the medicine is given in the wrong dose or in the wrong form. These are common errors. Someone has pointed out that in every 1,000 visits to the hospital, you can have as many as 10 people having an adverse event that leads to death because of the treatment in the hospital, most often drug errors. So we cannot expect hardworking, dedicated healthcare providers to avoid making these mistakes because they are a consequence. When you only knew 400 diseases in the 1900s and you only had 100 drugs that probably work, it was very easy to keep that in your mind. But once you reach the level of sophistication healthcare has reached now, then it's not possible for a health practitioner alone to keep track of all the things he needs to know. So obviously, if you keep your medical information in paper records, even more errors can happen. So that is why our new hospitals are fully IT implemented, but even there, decision support systems are often lacking, and doctors rely on their memory to provide right care. You're aware of all these new hospitals. We have Selayang, Putrajaya, Ampang, Sungai Buloh, Alostar, Perlis, Bintulu. All right. And of course, just take one hospital like Selayang. They had at its opening 1,200 PCs on a connected network. But even in that setting, mistakes can occur if the systems are not designed to provide good care. So we have a mantra, old mantra, information access anywhere, anytime. New mantra, ubiquitous information access anywhere, anytime, any device, which is the theme of our conference. And finally, the newer mantra, which is we only need the right content to be made available to the right people at the right time. We can't afford to carry all this information in our heads or look for it at the time of care. To make life more challenging, health clients, our health clients, those who come to us for treatment, have access to the internet, often Google on their disease, and often and not surprisingly know a lot more about the disease condition than the healthcare provider. Remember that the patient only is interested in his disease. So he spends all this time revisiting information about the disease he has, or his wife has, or his child has. But the doctor has to keep track of the 10,000 diseases and 3,000 drugs that we mentioned. And has actually expanded much more than the time when the quotation was prepared. So patients like me, you can communicate, share information with patients who have similar diseases. There are e-patients network where they actually share the latest, progress that has been made in the disease. And because they have this network of, disease groups or disease support groups or patient support groups, you find that they are up to date. So if you have a patient who comes to you and said, doctor or nurse, why is this? I'm not being given this medication. I went to the internet and I found that this is what is the modern treatment. You have to ask the patient, where did you see it? Can I have your website? Can you print a copy for me? And then you say, I am trained to check up the information. I can evaluate that information. That not everything you see on the internet is accurate. But if it is important, if it is correct, then perhaps we look at changing your management. So don't be ashamed to have patients educate you on modern management of conditions. Okay, so in the 20th century, we had clueless, isolated, doctor-dependent patients. So, doctor, you tell me what to do. Doctor, whatever you say, I will follow. Now, it is different. The 21st century, we have the net-savvy, well-connected, doctor-collaborative end user. And so, we need to now think about having net-savvy end users, online patient helpers who now provide life support or disease support or illness support through portals like the one I showed you. Then you have the online support groups. And finally, you have open source health. Medline, which is the resource that doctors often use, found that 1/4 of the people logging into Medline and looking for advances in medicine were lay people. And so because of such demand by lay people for the latest information, they created Medline Plus, a more patient-friendly portal but providing the same latest information as doctors would see from Medline. So your patient is now his best healthcare provider. The role of doctors has gone from directors or managers of his disease conditions to one of facilitator, supporter. Someone said health coach. Okay. Technology always fails me. Huh? Okay. This is, you're not going to be able to see that, but telling you how a lot of technology is going to come in the near future, and it's going to come faster and faster. Okay? An example of one could be artificial intelligence, robotics. So IBM goes big into healthcare. IBM is taking its powerful Watson computing technology and converting it into a cloud service that will help drive the collection and sharing of health data. So an example of this, in Singapore, you have got IHH group, of which IMU is a part of. The doctors who are managing patients in the ward will be informed based on the patient parameters which patient is going to deteriorate and probably will need ICU care. And it anticipates it and allows you to take action before they actually go into the intensive care unit. Watson is also being used to determine the best treatment for cancer for patients, because it can take into account not only all the patient characteristics, the other diseases the patient have, response to previous therapy, and some knowledge of latest knowledge, up-to-date knowledge on the more effective forms of treatment, and customize it to the patient, and therefore provide care that is more up-to-date, more effective than that any healthcare provider, no matter provide. Okay, tell you what we are doing in learning resources for the past few years to put all this in context. Okay, I am not going to read that for you. You can read faster than I can press the buttons. Okay, but we have providing a whole lot of digital resources that can enable students to keep up to date, continue to contribute to self-directed learning, and make them able to give their patients the best care that's dependent on the knowledge and skills they may have, and which they can use to continuously retrain themselves. It is said that students going to school now, 70% of them will be working in jobs that do not exist by the time they graduate from university. So in other words, how do you prepare? And after graduating from university, 30 or 40% of those jobs will either disappear or be changed dramatically. So how do you continue to prepare students who are able to stay employed, either working for an organization or alternatively setting up the organization which employs themselves as well as others. So we want students who are capable of developing their own jobs and future roles. So of course we have the use of electronic learning, e-learning, and individual departments have to adopt it. So how can we use technology to transform learning? Well, of course, we have a strategy. It's based on our learning outcome, based on the outcomes we want for our students, especially based on the competencies our students need to have on graduation. But remember, these competencies are only designed to make you effective for the next 2 or 3 years. That if you don't continue to educate yourself, you will rapidly become a white elephant in the place you are working. Okay, so very simply, our key initiatives, again, you can read faster than I can read. So this is a list of the key initiatives that we are planning for in the next 5 years. All this to ensure that information literacy, digital literacy, mastery of your subjects is possible. Now, of course, there are success factors which are necessary and need to be put in place or need to be utilized to succeed in making our students digitally literate, information literate, having 21st century skills, and I will not go into them because of the time we have. But this is important, what sort of students we expect to produce. Currently, they are passive learners, and lecture is the main way they are learning. In future, we want them to be active learners. We want to look up the material. We want them to present the material. We want them to apply the material. We want them to use information to solve problems. And each student in IMU must be able to move at his own pace, not at one standard pace that all students have to follow, but the students who are brighter, the students who can do things faster, the student who has more initiative can actually develop a personalized course for himself and move faster than other students who may have to move at a slower pace. There's core material that all have to acquire, but individual students can have their own pace. For that, we have to develop adaptive learning and learning pathways which are appropriate. Information and digital literacy is very important, and we want to produce critical thinkers, problem solvers, deep learners who have mastery of 21st century competencies and who become lifelong self-directed learners. Okay, this is the way we propose to achieve it. I'm not going to go through that. So it's not about technology, it's about education. How do we best prepare students who are able to update themselves continuously, who are able to keep training themselves, continue to acquire new competencies, and take on new jobs. Previously in Japan, if somebody joined a company, he expects to live there for his lifetime. Today, it is recognized that most people, even before their 30 years of age, maybe have worked in at least 3 or 4 companies and acquire more skills, more competencies, become a more rounded person, and it is about that student that we need to be thinking about. Okay, so the question is, the lecture-based system of teaching, which I am using now, is 1,000 years old, and it's not a very effective way of learning. This is what a lecture hall looked like 1,000 years ago. Some of the students are sleeping, others are talking to each other. A couple there is, looking at each other and not at what the lecturer is doing. And this is a more modern lecture hall. The more modern lecture hall, somebody is on Facebook there, somebody is sleeping there, couple of people are more interested in each other than in the lecture hall. So in other words, we are using these same 1,000-year-old techniques today, and great difficulty recognizing that they are no longer appropriate for the teaching of any competencies. So just a few more slides. The student in 2017, high-tech, high-touch, always connected, impatient with traditional pedagogy, multitasking, and expects to be engaged. So we need to use gamification. All right, but unfortunately, the teachers are not very information and computer literate. So we need to use students to produce their own learning materials, and they can do that much better. Of course, the attention span is short, so we cannot have any long lectures like this one, half an hour, 40 minutes, because we lose the attention of most of you after the first 7 minutes or so. We need to provide just-in-time learning, and these students are often rule benders, innovative, imaginative. Insight will come with time, I suppose. All right, so I'm not going to compare modern learners versus their teachers who are digital immigrants, but these are the competencies or characteristics of these two people. But I want to share one vision before we finish. We are trying very hard to bring in more students to IMU. We are worried about the diminishing number of students who actually joining the different courses. Some courses had to be stopped because of the inability to get enough students. Now, if we continue to work on incrementally increasing student numbers or maintaining student numbers, we will get nowhere. Can we think a bit laterally and think of IMU as a place that will have more than 20,000 students within the next 5 years? If so, you will be looking at the problem in a very different way. You'll be looking at it as an opportunity, not a disadvantage, not a challenge. And of course, you can need to change the IMU campus so that students come here for the socializing, which is so important in campus life. To learn how to mix, to learn to live together, to learn to share. Those things you come to campus for. You have PBI rooms and you may have clinical skills simulation room where you come and do practical hands-on thing, but no lectures. The rest of the campus is actually you expect to get your content delivered to you online, which you can look at anytime. You get your formative assessments online, so you can see how well you are doing, what are your weak areas, and then subsequently use the assessment to self-direct your learning. All right? And of course, a lot of the students who may be coming to IMU are taking part-time courses, may be doing continuing professional education courses. That means we have to think outside the limits of the courses, traditional courses we now provide. Okay, and so learning content, I'm not going to go through that, but the learning content is given for you to dip through, to taste. You are not given as something that you got to go through, but you use your assessment tools and the formative assessments to determine which areas you are weak in and use that to guide your learning. I just want to, so these are the characteristics of the 21st century learner, of which digital literacy is one, information literacy is part of digital literacy, and these are some of the activities that we use to deliver it, and we want to make students master the newer tools, not Moodle, not Mahara, but the more modern tools which students are already using in their social lives, but can easily be accommodated in the teaching of students, especially self-directed learning. Okay, so last slide. What do we need in future? Critical thinking and problem solving, collaborative skills, agility and adaptability, initiative and entrepreneurialism, effective oral and written communication, assessing and analyzing information. Information technology will come here, and finally curiosity and imagination. When you go for job interviews, these are what your future employers are looking for you. Remember, even in medicine, the government is only agreeing to give you a contract for 4 years. 2 years housemanship and 2 years subsequent to that. For many of the other courses, you have to apply and you may or may not get a course, get a place. But these are the things employers are looking for. There is a similar slide that comes from the Economist, which also more or less repeats this. So once again, you know, teaching as we do in IMU, lecture-based teaching, student being passive recipient of education is no longer the way to go forward. That we need to change faculty first of all, but students also got to demand this sort of, you know, education. In fact, you can take charge of your learning by yourself using these tools rather than wait for them to deliver to you by your individual courses. Thank you.
Thank you, Datuk Chai. Henry Becker once said, "A library is no luxury, but a necessity." Our next speaker is a high advocate for that. She is a former chief librarian for University Malaya as well as University Science Malaysia. She has published numerous papers circulating research topics such as information literacy, library science education, and journal publishing. She is also the president of Persatuan Pustakawan Malaysia. I would like to welcome Dr. Nur Ezan Che Nasir. Please give her a hand.